Welcome back. Time right now is 7:14. With spring and allergy season here, this could be a difficult time for asthma and allergy sufferers just like me. And with me this morning is Dr. Suprenant, the Buckeye Health Medical Director, with how to identify triggers and what you can do to prevent asthma attacks. Thanks for coming in this morning. This is a really big deal this time of the year. Really appreciate it. Can we just start off with just a general, what kind of is asthma for people who may not really know what it is?
Sure. Asthma is a chronic condition that causes swelling in the airways and mucus secretion. It makes it difficult to move air into and out of the lungs.
And that gives you that hard to breathing and that kind of wheezing feeling, the tightness of the chest kind of a feeling?
Those are the symptoms: shortness of breath, tightness in the chest, wheezing, and coughing would all be common symptoms.
And what are some of the triggers? Because I know a lot of people, myself especially, can go from being fine to really overwhelmed pretty quickly, especially this time of the year.
That's right. Well, this time of year, allergens like pollen are big, but other key triggers would be pets, smoke, pollution, cold air, and respiratory infections.
And these triggers can kind of be different from person to person too, so it's not one of those things where everybody who has a pollen allergy may necessarily have an asthmatic reaction to pollen, but there could be other things as well, right?
Absolutely. So each individual needs to learn what their triggers are, and they can work to avoid those things.
And can this be kind of developed over time? I know when I was younger, my asthma wasn't as bad as it is now. Is this something that can kind of fluctuate or get worse as people maybe get older as opposed to when they were younger? Is it one of those things where once you've, say you don't have it when you're young, you're set and you're good to go? Can it be developed?
Yes, absolutely. So it is more common among children, so therefore some people do not have as much of a problem when they're older, but that can also be the reverse, that people can develop it as they age too.
Yeah, that was my issue. When I was a kid, I was great, and now it's not so great. So if you are, say, someone who develops it a little bit later in life, what are some precautions or some things you can do to kind of reduce the amount of maybe flare-ups that you have?
I think the most important thing is to take your medicine as it's prescribed. Many patients, when they feel well, tend to not take their medication. And it's important to realize that it is a chronic condition. There's no cure, but there is really good treatment. So people should take their medicine as prescribed, watch out for their triggers, and then if they notice that they are getting worse, they should see their doctor right away.
And then as far as people that maybe have an inhaler for types of episodes, it's also important to keep up with those and keep them up to date and not use ones that are expired too, right?
That's a good point. We hear of people who are using expired inhalers, somebody else's inhaler,
yeah,
the wrong inhaler. So yes, taking your medicine as it's prescribed for you is really critical.
It's extremely important. It sounds like a no-brainer, but really when you think about it, right, if you're using someone else's, you're using something that's not supposed to work anymore, it's not going to do much. So again, the triggers, know your symptoms, and make sure you're using your own meds, right?
Exactly.
All right. Thank you so much for being in here. Dr. Suprenant.